My name is Sue. I'm from Baltimore, and I've had GVHD for 2 years now. Prior to my illness, I had a very full life. My husband and I have been together for over 40 years. We have 3 kids and 6 grandkids, and we're a pretty enmeshed Jewish family. I'm a social worker, and my day job was to work for the school system. So getting sick just stopped all of it. It's like it all happened in one day. On October 16th, 2019, I went to work. By 12, I could barely walk. I was dizzy, out of breath. I couldn't move my left arm. The specific diagnosis was ALL, acute lymphoblastic leukemia, B subtype Philadelphia chromosome positive, which means that I carry a genetic mutation. Who knew? The doctors told me that I would probably need a bone marrow transplant. So my bone marrow transplant was on June 2nd of 2020. And after a few weeks, I started having symptoms where I was very itchy. And aside from spending all this time in the bathroom, I'm now itchy. And I'm also getting little purple spots. It's like on my arms and then also like on my legs, on the lower part of my legs. After I was discharged from the hospital, they sent me to the chief of dermatology, and that doctor is the one who told me that it was GVHD of the skin. Then it was formally diagnosed and put into my chart that it was acute GVHD. Before the bone marrow transplant, they had a class and they had to do it on Zoom. And that's when GVHD was mentioned maybe for about 30 seconds. They basically said you could have graft-versus-host disease, and when your immune system is all settled, you'll be fine. No one ever made a big deal about it. So after dermatology, they told me a little bit more about GVHD. They said, once I've had some symptoms, the risk of having more GVHD problems is now increasing. It may take a different form. It might look different from now on. It could get bigger. We don't know what's going to happen. Some of the symptoms of GVHD that started to develop were eyeball issues. I felt like I wasn't seeing correctly. And sure enough, they sent me to an eye doctor who was also very aware of GVHD things. The other symptoms of GVHD that were continuing was still the rash on my arms, and my face would get itchy. My eyes were feeling very dry, and still stomach aches. There were still issues, with the vomiting and diarrhea. Once I was diagnosed with acute and chronic GVHD, I would say that the information from the medical team, it was still really minimal. They didn't spend a lot of time talking with me about all these other symptoms. Most of the things that I know are things that I've researched myself. If I ask questions, they will answer them, which is why I have to do my work and be prepared and look at the research and then go and ask them. Currently, when I want to learn things, I go on the computer and I'll look at sites like GVHD Now. When I go to the doctor's visits now, I do try to be very much prepared. I literally take a pad of paper and a pen with me. My husband has just been amazingly wonderful.
Every time that she's in there for an appointment with the doctor, I'm sitting in the other chair.
I think it's definitely an advantage that the two of us will go in together because we look at things from maybe a different perspective.
She might have forgotten that she had these spots here or there, whatever. So when she had her list and said, Doc A, B, C, D, E, and then she might have forgotten. So don't forget, you've got this other situation going on. You'd have to just interject so you make sure that docs knew everything. They didn't get part of the story.
I think it's so important to stay busy. So I write and I draw and I color and I paint. I do a lot of meditation. Mindfulness is very important. My faith helps me every day to get through the journey. I think that we're all here for a reason. I think everybody has a purpose in life, not just your career purpose, but your family purpose. Looking back, I think a lot of things could have been improved. I would have appreciated more of a medical narrative about GVHD. What I wish I would have known specifically about GVHD is that there are 2 types. There's acute and there's chronic, and it can affect different body parts. I think people need to be better educated about GVHD. I want people to know about this. I want the doctors and nurses and all these oncology people to talk about GVHD. It's a whole other set of symptoms, and I think it's really important that people pay attention to it.